Hi, it's Jason. Today I'm going to read Chapter 14 of Floki's Army. Chapter 14, Let's See What We Can See. Since things were going well with Floki, Jason and Paula decided to take him to the ophthalmologist to see if they could do anything for his cataracts. Maybe they could make his life even better. Wouldn't that be nice? They had no idea how long he had been blind, but had spoken with others who had success with cataract surgery for their dogs. After a short time in the waiting room, Jason, Paula, and Hannah and Floki were escorted to an examination room and were greeted by a doctor shortly thereafter. She asked questions of them concerning why they were there and what they were hoping to accomplish. They told her their brief history with Floki and assumptions made about his past. They then asked if there was anything that could be done about his cataracts to help him see a little. The doctor listened and then started the exam. Of course, the first thing she did was take a look at his eyes. After that, she got out a scope of some sort and turned off all the lights in the room. The scope had a light on it and apparently allowed the doctor to look into Floki's eyes. She took her time and looked at both eyes very carefully. When she turned the lights back on, she wrote down a few notes and then began to share her observations. Cataracts are not his problem, she said. Most of what you see is scar tissue. He is blind because he has puncture wounds in each eye. Both Jason and Paula, and maybe even Hannah's, hearts sunk. It didn't make his sight any worse, but to think of something like that could happen to their boy. There was no way they were from a dog bite, because the punctures were straight in. A dog bite would have come from the top and the bottom. Someone had to have done this. They needed to clear their heads so they could focus on the doctor and possible solutions. Maybe there was still something she could do that might help a little bit. "Is there anything that you can do to help him?" asked Paula. "Well," said the doctor, "his right eye is essentially dead. It no longer produces any moisture. It's a dry eye. His left eye may be picking up a little bit of light. I think I detected a tiny response while examining it. We could remove the cataract from that eye, but it will be a little tricky because of the scar tissue. The chances of success aren't as good as normal cataract surgery, but I think we can remove that cataract." "Okay," the doctor said. "Why don't I give you a few minutes to discuss this?" She left the examining room so that they could have a private discussion. Once she left, Jason and Paula both blurted out their thoughts that they were holding while the doctor was talking. They both couldn't get over the fact that someone had punctured their boy's eyes. They needed to get beyond that now. They were both not comfortable with the strong sense of maybe. She didn't use those words, but that is what they both heard. They were aware of Floki's age, his condition, and his most likely diminished immune system. Would he be able to survive a surgery like this? Even if he could, would they chance it on a maybe? Paula's father had great wisdom. Towards the end, a surgeon suggested that he could do a procedure to help her father's heart. Her father responded, "At my age, you don't come out of the hospital better." That very well might apply here. They were getting the feeling that the surgery is more important to the doctor than the outcome. When the doctor returned, she had a packet for them. It consisted of a folder filled with several sheets of paper describing her conclusions and recommended the procedure and the follow-up protocols for the next 2 years. It also included costs and possible financing. Jason and Paula started to express their thoughts that the risk might be too great for Floki. Then the doctor mentioned that if they did not do the surgery or not take the necessary medications, Floki's left eye would dry up, causing glaucoma, and would have to be removed. "Well, tell us about the option of taking the medications instead," they said. "He will need to take drops every day in his left eye. Because of the nature of the drug, you will need to order this medication from us. The drops are immune suppressing, but will be fine for him. When you administer the drops, you will have to wear rubber gloves because this medication has been known to cause cancer in humans. What? Asked Jason. These drops can give cancer, but not to Floki. Yes, she responded, because they are administered through the eye, it will be safe for him. They had heard enough. Paula very politely, but quickly, told the doctor that they would need to go home and think it over. She knew that Jason might say something that would make this meeting very uncomfortable, and she wasn't far behind. The doctor handed them the paperwork and said that she would wait to hear from them. This presentation took an hour and a half. They paid for the visit even though the girl at the front desk wanted to bill them. They both knew without having the full conversation that they never wanted to hear from these people again. They would pay their bill now and not have to correspond with them any further. That is the way the Purcells handled things. Once in the car, both Jason and Paula started speaking at the same time. They didn't get to have a full conversation, but they knew they were together on this one. Jason pointed out that the doctor said Floki's left eye would dry up, causing glaucoma, and have to be removed if they didn't do the surgery or take the medication and do the follow-up visits. Did she not remember that she told them earlier that his right eye had already done that, yet no mention of glaucoma or removing that eye? It seemed that the sales pitch was not thought through completely. She was trying to scare them into doing something when it seemed like nothing could be done without jeopardizing his overall health. This was a non-aggressive bullying tactic, using fear to produce a desired result. Paula brought up the question of, how could we give him anything that would suppress his immune system? How could the doctor not look at him and see that he would then be susceptible of any germs or any viruses and not be strong enough to fight them off? What about a drug that might give us cancer but be fine for Floki? They went on and on until they got home. They went in their house, kissed both dogs. It was good to be safe at home. At least they had tried. Floki seemed happy to them, and that was the most important thing. If they could make sure he was happy and unafraid, he could live out the rest of his years knowing love. When it came to Floki, it was about prioritizing. Not everything was going to be perfect. They needed to make the best decisions for Floki. Good intentions and bad decisions often end in tragedy. They needed to be smart and careful if their boy was going to live the life that they had hoped for him. A lot of well-meaning people say things like, all it takes is love. Love is a nice place to start, but it couldn't be all they had to offer their boy. Love can be blinding. They needed to see things clearly and do what is best for their dogs. They must also never forget that they were dogs, and caring for them as if they were human would most certainly shorten their lives. End of chapter 14. Thank you.